All right. Well, good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. It's July 7th, 9 o'clock. So thank you guys for being here live on the call. We do this because our mission is to serve those that serve others. That is you, the agent, so you can go out and serve your community the best way that you know how. So we are in the 2026 recertification season. And so the first thing I want to do is obviously go through some of the things that are going on in the industry right now, but specifically on training. So I'm going to share my screen here. We will go through all the good stuff this morning. So let me share that. All right. Okay. If I can get a thumbs up from somebody in the chat, if you guys can see my screen, okay. Sometimes it works, sometimes it doesn't. Want to make sure that we're good. Got a thumbs up. Cool. Thank you. All right. So training calendar, we'll go down to learning, go to our training calendar here. And as you know, we've got training for the week. So this is what I like to do is I go up to this top part here. Fernando has set this up so you can look at it from the weekly view. So this morning we've got some trainings. We've got Devoted doing an agent onboarding. So if you're new to Devoted, you can check that out at 9 o'clock. We've got a virtual training with our contracting team. Those of you that are newly contracted with HPM, this might be a good one to jump on at 10:30 today. Edna's doing a level up your Medicare game. This one's in Spanish and Espanol. So if you're into that, we've got United Healthcare Medicare Fundamentals at 12 o'clock today. Edna's talking about lead generation at 1 o'clock today. And then Humana and Care Plus is going over their dual eligible plans at 4 o'clock today. So this is the training for today. We've got tomorrow, Freedom is starting their grab and go events. If you're in the Central Florida market, you can swing by in Kissimmee. They're doing a grab and go event, breakfast, which is 9:30 to 10:30. Also, you've got dental, vision, and hearing benefits. This is through Humana. That's at 11 o'clock tomorrow. United Healthcare is doing a training for getting ready for your certification for 2026. If you haven't done that yet, you can jump on that at 1 o'clock. Humana, knowing your special election periods. If you want to continue earning throughout lock-in and the summertime, this is a good training to be on. This is at 4 o'clock tomorrow. Moving on to Wednesday the 9th, we've got Al Clancy doing his virtual coffee and chat. This is your coach. He is here at HPM to help you level up. So that's 9:30s on Wednesdays. United Healthcare is going over special elections at 10 o'clock. This looks like it's in person. You've got a game show. Looks like they're doing something fun there at the Maitland event, or a Maitland office rather. Also on Wednesday, Spark is going after the social media success and strategies there at noon on Wednesday. United Healthcare also at noon is doing grassroots marketing, followed by their game show at the Maitland office at 1 o'clock as well. And then Spark, again, another social media success strategy at 1:30 on the 9th. On Thursday, the 10th, we've got WellCare in the office. That's at 10 o'clock. Susanna will be there to answer any questions. If you're in the Central Florida market and you need a little boost, it might be a good idea to stop by our office on Edgewater there at 10 o'clock on Thursdays. You've got United Healthcare doing a new agent orientation. If you're new to UHC, this is a great training at 1 o'clock on Thursday. And then we do our very own HQ intro, which we're going to talk about a little bit this morning as well. That's at 3 o'clock on Thursdays. On Friday the 11th, Tom Ryan is available from 9:30 to 10:30 on all of our HPM selling tools. So he'll go through HPM Shop and HQ and all the good stuff there. That's on Fridays at 9:30. And then if you look at Aetna, they're doing their podcast, Grassroots Marketing, 11 o'clock on Friday the 11th. That's the training for the week, guys. Remember, we've got to keep one foot in the classroom and the other one in the field at all times. Make sure that you take a look at the training calendar. Again, it's very easy. You're going to go into your HQ portal. You're going to go down to learning and you're going to click that training calendar. Okay, so what training are you going to go to this week? I want to see it in the chat. Which one are you committed to this week? I want to see some good chats here. Commit, guys. Even if it's one training, I guarantee you will walk away and learn something new. I'd love to see somebody post something in the chat here on which training they're going to be at. Wake up, wake up. Let's go, guys. It's certification season 2026. Restart has started on June 23rd. We have AHIP, which has already launched. That is available. There's a link right at the top of HQ. And you automatically get a $50 discount using our link. So all you got to do is click that, and the instructions are there, and we'll get you into that. So upon checkout is when you'll see the $50 discount. So the normal price for AHIP is $175, and then you'll see the $50 discount when you go to checkout. So that's already set up. If you've already gotten your AHIP done, let's see some thumbs up in the chat. Love to see that. In the chat here, we've got Aetna lead generation. Gail's going to do that one. Awesome, Gail. Spark social media training. Lena's going to get that done. Brenda's going to UHC. Natalie's going to Spark. Ryan's going to Spark. Social media. Mary's going to social media training. Patrick's going to UHC training. Marie's going to Spark and Aetna. Awesome, guys. That's what I'm talking about. I mean, even if you just do one training for the week, think of what that will do, week over week, right? Now, I know this is hard because you're going to have to kind of balance your training with your research. So, do at least, in my opinion right now, depending on how many carriers you have, you want to try to get, one of those trainings done at least once a week right now. So get that done. Priscilla's going to Spark training. Love that. AHIP is done. Way to go, bud. Way to go, Sonia. All right. So under contracting, I also want to show you guys recertifications. You're probably getting tons of emails, but what we did is centralize this. So thanks to Mike and his team. If you click contracting, go down to recertification 2026. We have all the carriers. So you'll see here at the top, the AHIP training is here, 2026, and then FFM hasn't launched yet, so it says coming soon. So as soon as that is launched, you'll be able to do that right there. And then as the carrier trainings are rolling out, you can go ahead and get those done. So Aetna's live, Alignment's live, Anthem's live, and then the ones that are not live, you can see it says coming soon. So just check back, daily, weekly, whatever that looks like. Devoteds is out, Elevance is out, so you can go and get those done now. And as they start to roll out, we'll continue to update this and get this up to speed. Okay. So just check back on recertifications. We'll continue to centralize them here. So if you're lost and you're not sure yet, Mike and his team is going to get these up to date and ready to go. In the chat, he says more carriers are released daily. So thank you, Mike. I appreciate that. Yeah, it seems like at least once or twice a week, we're getting recertification notifications saying that they're live. I know you guys are getting emails, so as you get those, go ahead and knock them out. I mean, don't wait, get them done. Don't delay, okay? We have also learned, as far as like recertifications go, that NABIP, and I'm going to go out to their website, NABIP, which is the organization that we really feel strongly you should consider joining. So this is NABIP. Again, they have their own Medicare Advantage certification. So if you click that, you do have to be a member, but I think it's only $100, and everybody, almost every carrier accepts it except for Aetna, and Aetna has their own certification, which is free if you're part of whatever they do. So if you're interested in this, please send us an email to support@askhpm.com and ask about the NABIP discount. And they have their own Medicare certification. So if you have not yet taken AHIP, you can save, about $25, which isn't a lot, but it seems like all the carriers are taking this. And Mike, just of note, if you want to get with me, we'll figure out how to get that linked and synced to the HQ as well. But it's at support@askhpm.com, and we can get that to you. And then Gail is asking for the link to join NABIP. just shoot us an email because it's a special application. And we have an exclusive deal for a discount with NABIP. And we're one of the, I think we're the only FMO that gets a specialized discount for NABIP. So it has been fantastic. Oh yeah, if you just click this, here it is. Yeah, so it's $100. You do have to be a member of NABIP. And so the certifications is accepted by all of the carriers except for Aetna, and I think they're being chased around for that as well. So Mike says he's working on the NABIP process in HQ, and it should be live later this week. So thank you, Mike. I appreciate that. So yeah, just keep checking back, and we'll go from there. All right, I'm going to stop sharing my screen, and I'm going to do a quick question here. Okay. All right. Got that done. And just going through the chat, making sure I got everything up to date. Okay, cool. I want to talk about, we do have a special guest on the line, but I'm gonna let her take the mic here in about 4 minutes. But in the meantime, I want to talk about what you should be doing right now for the rest of this season, right? So we're in lock-in. You've got certifications rolling out. You've got trainings coming out. You really should be doing at least one training per week outside of your recertifications, okay? You need to be preparing your mind for the next selling season. It is 2026 selling season. And what that means is we can't officially sell a plan until October 1st for Medicare and November 1st for ACA, okay? But that doesn't mean you can't start now. It's July. So you have the ability to have a running head start. And what that means is if you want to have a successful season, you better have enough leads going into the selling season in August and September, okay? So August is next month, right? September is the following month, and October is go time. So we're within 90 days here of our selling season. And if you haven't started the process of lead generation, you are behind, okay? You need to start building a list of people that you will go see in October. Now, some of them will be clients. We get that. That's more reactive. But what are you doing proactively to generate leads, okay? Are you doing community events? Are you working with the physicians? Are you calling all the leads that you may have had last year and just kind of forgot about them? Do you have them centralized somewhere? Do you have a list of leads in one location, even if it's on a spreadsheet? Do you have a CRM system that's organizing these leads, right? Are you doing mailing campaigns? Are you investing in leads, right? Are you doing seminars? Are you going to churches and being part of those groups? Are you doing talks about your expertise? These are all ideas. Are you going to pharmacies? We talked about that. Are you going to pharmacies? What are you doing right now to generate leads? I think this is really important. If you care to share, put it in the chat. Just tell us what you are doing right now for lead generation. You don't have to give away your secret sauce if you don't feel comfortable doing that. That's fine. Are you posting on Facebook? Are you making videos? Are you, texting your friends and letting them know that, that you need leads? Are you calling your clients and asking for referrals? When they call you with a problem and you solve it, are you asking for referrals? These are, there's 1,000 ways. I used to say, I don't know one way to make 100 leads, but I know 100 ways to make one. Still gets us there. Gail's saying that she's doing seminars with veteran groups. That's amazing, right? So if you have a special niche like that, get that done. Rosie's going crazy. She's doing AI generation. She's becoming a guru on TikTok. And she's competing with Cuevas. Way to go, guys. I love that. That is amazing. Rick, if you need the link for AHIP, it's in HQ. Just log in there. It's at the top. And you'll get the link there, but somebody can post it here in the chat if you want to help out with that too. Lead generation, guys, if I'm going to be doing some stuff later this week and building out some courses on what you could be doing for lead gen. But if you have nothing going on, now is the time to think about that. Okay. Because time is short. Now, with that, I see our friend Natalia, and I'm going to make her a presenter here. So, good morning, Natalia. Natalia is with Advent Health, and she is our special guest speaker today. And she's linking and syncing right now. So while she's doing that, I'm just going to talk very quickly. Those of you that have not yet had the pleasure of meeting Natalia, she is an HPM alumni, and she is in charge of growing the Advent Health Well 65 centers, which are growing exponentially, and they are looking for partnership with with you guys, right? And she's here to give you the good news about Advent Health and what you guys can do to grow your book of business while partnering with a quality doctor in Central Florida area, which Orlando, Tampa markets specifically. And Natalia, I think you might be on mute, but
Here I am.
Gotcha. All right. Welcome back.
Thank you. It's an honor to be here today.
Of course.
My camera's not turning on, so I don't know why, but as long as you guys can hear me, it's all good. Good morning, everyone. I hope everyone has an amazing Monday and rest of the week. I want to thank you guys for those that came out to our open houses a couple of weeks ago. It was a great time to see you guys and give you a tour of the offices. I do have some updates today, so I'm going to run through those here. The first one is we now have a broker hotline. So this is a line where you guys can call directly. There's 3 dedicated agents that will be answering your calls, and they are bilingual. So that was rolled out about 3 weeks ago, and it's been awesome because this is where you can call to ask any questions and to make new patient appointments. So I am going to put the number in the chat right now. Make sure you guys save it into your phones and give us a call whenever you have any questions regarding providers, you need a provider ID, or you want to make your new patient appointment. And that is Monday through Friday from 8 to 5. So there's no break in between. The other thing is, I know last time I was on, I spoke to you guys regarding a new location we're opening in Orange City. So the date has been pushed back a little bit. It was meant to open at the end of this month, but now we're looking at late September. So once we open that location, we plan on having 2 providers there, an MD and a nurse practitioner. But I will also make sure that you guys do receive the invitation for the open house to tour that facility, meet the providers, and meet the staff. Similar to Freedom, we're also doing a broker power hour. So this is going to be a time for you guys to swing by the office. If you have not yet done so, meet the providers, get a tour, get a little bit of information regarding our model, pick up a lunch, and then also take a broker toolkit if you have not received one yet. So the broker boxes have been a hit. There's a lot of good goodies in there and information and brochures that will help you when you're getting in front of someone that might consider joining Advent Health Well 65. So the first one is actually in Winter Garden. It's going to be this Thursday from 11 to 1. So if you have a chance, please swing by. We will be there. The team will be there. The next one we have is on July 14th in Zephyr Hills location. Same time, 11 to 1. And then we have one July 15th in Altamont. And then we have one on July 22nd in Sanford. So it would be amazing to see you guys just swing by. We try to pick the best times possible. So 11 to 1, if you're out, you want to grab a lunch, you want to say hi, meet the team, meet the office staff, meet the providers, and also pick up another broker box or your first one if you haven't had one yet. Yes, I will drop those locations in the chat. We do have a new provider in Eustis. Her name is Debbie Kruger. She is accepting new patients. I know that's one of our busiest locations, which will also be a location where we're looking for either a satellite office or a new facility overall to really fit all of our patients, our providers. And it's been growing. It's been doing an amazing job growing. So we do have a new provider there. Operationally, we do have new office hours. Before they were 7:30, they opened. Now all of our office is open from 8 to 5. So wanted you guys to be aware of that. We are making some operational changes just to have better access, make it more convenient. And we're also looking right now into possibly getting some Saturday hours going. So for those patients that or clients of yours that still work during the week, now they're going to be able to come in, or they will be able to come in on the weekend to see the provider. So as soon as that's done and settled, I'll make sure that you guys are well aware of that. And with the office hours, also we rolled out new templates. And so this is new scheduling templates. And the purpose behind that is to really have the provider maximize their time throughout the day and get more patients in and see more patients. And that includes going from basically all appointments being anywhere from 40 to 60 minutes. Now they're going to be 20-minute appointments, 40-minute appointments, and 60-minute appointments, mostly for those new patients that are coming in and those transition of care patients that are transitioning out of the hospital. Our biggest announcement is that effective 8/1, we will now be going live with Care Plus and Humana HMO. So we've only had PPO. We weren't even seeing any Care Plus patients. So effective 8/1, we will be accepting Humana HMO and Care Plus HMO. I do have those provider IDs. So I will make sure I either send those to Justin or Nick or Sergio so that they can get them out to you guys. But that's a pretty big deal. It's really exciting. I've already received a ton of calls from many different brokers asking for those provider IDs to start signing those patients up. So please make sure that you look out for that email regarding our numbers. And also make sure you guys follow our LinkedIn. It's Well65 on LinkedIn. That's where we post a lot of our updates. Like everything I just went through has either been posted there or is posted already, but it's a great platform for you guys to see what we're doing, what's happening, what's coming. Right now, we're really just working on hiring providers. It's pretty difficult to find a provider that has, the value-based care experience and has worked with seniors in the past and understands the model. So if you have any recommendations, please feel free to give me a call. We're looking for providers for Daytona, for Tampa. We just hired a female nurse practitioner for Winter Garden. So now it's not just all male providers there. We just brought her on. She's ready to roll, credentialed, and accepting new patients. So if you get a chance this week, swing by on Thursday to meet her. She's phenomenal. But there's a lot of changes happening with the Well65 locations. We're looking to open up, not this year, but probably mid next year, or definitely by the end of next year, locations in Leesburg. We're looking at a location in Ocala. And so our plan is to grow, but grow the right way, find the right locations where patients really need us, work with the right health plans, and most importantly, with the right brokers. So again, I want to thank you guys for those that were able to come out to our open houses, but please swing by our broker power hours this week. And like I said, grab a lunch, get a tour, meet the providers, take a broker box, and then you'll be on your way. But again, this is a great opportunity for you guys to get your face in front of the center administrator. When you walk into our offices, you will never see any insurance information or broker corner anywhere. You'll have that relationship directly with the staff, and you can give them your information as well. So besides that, those are my updates. Anything new that's happening, I'll make sure that you guys are up to date. We have definitely been growing, and I know that I've been working very closely with a lot of you guys, whether it's a seminar, whether it's an event, but it's been amazing to see the growth and the support from everyone. Any questions? I see that in the chat you guys are asking for the dates. I will send that out. I will make sure that you guys have those. And yes, super exciting that we're going to be seeing the Care Plus patients coming in.
Amazing. Thank you. So you got new locations in Leesburg and Ocala coming soon. Your strategies, do you know the strategies behind that? Is it mostly like built around your hospital systems, or are you looking at certain pockets of seniors, or do you have a different strategy? Just so kind of like these guys know why, like the rhyme and reason why you're opening up centers in certain areas.
Yeah, it's definitely the pocket of seniors, the demographic, the income. the ability to serve, or more the need versus the ability to serve. So we have the ability to pull these amazing heat maps where they show us, here's the number of providers that see these types of patients under these health plans, and here's the actual amount of the patients that need to be seen. So considering what they can see versus what's left, the remainder is where we really want to open our locations. It's really just exactly, the model HPM has is, serving those that really need, the support, need the resources, need the right providers. And that's what we're doing right now. That's how we plan. That's how we foresee, potential success and the ability to really put our mission out there. As far as Health First, we do have a partnership with Health First. Not necessarily, the Well 65 locations. It's just an overall Advent Health. There's a partnership with the health plan. And to be frank, right now, we're really working hard to build that relationship here. So I've been working a lot with LaToya. We've been doing a lot of seminars that I know that you guys have been at. And I know they're going really strong this year. They're really wanting to grow and develop. And LaToya's been amazing. The whole team has been really phenomenal to work with. They're definitely, 100,000,000% for you guys. And so I support that. I love that. I love that they're always available and willing to do whatever it takes to make sure that you guys have what you need. So that's where we're at right now with Health First. Not necessarily, we're very payer agnostic. We want to work with all the health plans, but they've been ones that have really stepped up and shown the support. We're right now building relationships as well with Freedom, with Devoted. We have a really great relationship. So the plans that we accept right now are Devoted, Freedom, Aetna, Cigna, Florida Blue, United Healthcare, Now Care Plus, and Humana. And we do see any person from the age of 18 and up that is on Medicare. So before that wasn't really a thing. It was they have to be 65 and over, but now it's any person. Yes, all locations. That's new now, because before we were only seeing people that were 65 and over, but now we're seeing anyone that's on Medicare. Actually, you know what, Rosie, the only ones that we're not going to be doing the Humana and Care Plus, I believe, is Zephyr Hills, and there's one more. I'll make sure I get that information over to you guys.
Yeah, that's
yeah.
So I'm just looking at the map of like where your locations are, and it's I-4 corridor at this point, but it looks like you guys are expanding elsewhere, which is great. But hack code guys, like Natalia just told you, like they're doing research. They know where the seniors are. They know where they're living, and they're putting a center in their backyard. And so like, if you're not really sure where you should be focusing, maybe check out the Well 65 centers, because they're putting them exactly like where the seniors are. And so what I'd like to ask you, Natalia, because you've been on both sides of the fence now, and like these guys are, we're within 90 days of AEP right now. You know how important it is for us in our having great provider relationships. The open houses, I'll just say, like, if you're not going to an open house, shame, like you got to know who the doctors are in your neighborhood. Go meet them, go talk to them. And because when you bump into somebody that's like, hey, I need a new doctor, and you're the person that's doing that, you kind of want to know who this person is that you're referring business to. So like, the main objective is, that solid patient-doctor relationship. It's not like, oh, well, I put 2 members in Advent Health and they don't give me any leads. Don't think like that. That's very not the way you should be doing business. What you should be thinking is can I put my patients in a practice that's going to respect my clients and keep them locked in there? That's objective number 1, right? And then objective number 2 is build a relationship with them, because they're not going to be able to help you. So I may have said too much, but like, Natalia, what are your thoughts on like what these guys should be doing to prepare for AEP, especially with Advent Health and like what you guys are doing?
Yeah, I think the most important part, like Justin mentioned, is building the relationship with the office. Coming in, saying hello, meeting the staff, meeting the providers, utilizing our broker rooms for any appointments that you have, or anyone that's interested and wants to do a tour. We also have our activity or wellness rooms, which are like the activity centers within all of our locations. that you're more than welcome to come in and use and do either a seminar or an event. But really getting your face out there. Historically, we were using Chapter. And so Chapter is like a virtual, kind of like a broker hotline type of thing. That's no longer being used. So that's, under no circumstance should any office or anyone on the access team, which is, our call center, be utilizing. So right now they are using who comes in and drops off a business card. They are handing that binder to the patient. I've seen it myself. The other day I walked into an office and they were having that conversation, hey, I'm not happy with my insurance. And the office manager automatically grabbed the binder and said, well, look, we have all these partners here that are local that you can meet with them face to face and can help you. So making sure that you have your information in there. Right now, we're not really doing any in-services, but you're always welcome to swing by and meet the office manager. And also the social workers. So our offices have social workers, and this is not just social work for the patient, it's social work for the entire family. It's making sure everyone's taken care of in that patient's family. And they're also a huge part of getting resources out to the patients. So just swinging by and saying hello. I know Al's been at our locations. I know that a couple of you have swung by and said hello and dropped off your business cards. But if you don't make it to, to do that, at least make it out to one of these power hours. And I'll make sure that your information is handed over, put in that binder so that the patient can, have their options open and readily available. And then just making sure that you utilize your resources, having space where you don't have to pay. Anything that we really do in the activity room, we can also promote on our social medias. So there's always capability for you guys to have people to come in and really, get your leads up for AAP.
No, that's awesome. And, location is a really big deal because, if you position it as, what I've seen is like, if you're just another sales agent selling health insurance, it's going to be a hard pull. But if you're like, hey, check out Advent Health, and I'm here to talk about, your options for, health insurance or Medicare, or maybe even like how to save money on your medications, or learning about Medicare Part D for 2025, 2026, or, think outside of the box as far as your topic is concerned. I mean, even just an ice cream social, just come in and get some free ice cream. It's stuff like that, guys, is thinking outside of the box where you can absolutely, get into one of these centers and they'll help you promote it. We'll help you promote it. We'll figure out how we can get, one of the health plans to help you promote it as well. So there's lots of different ways to generate leads in this way. So, but the thing is like what she's saying is like, if you're not showing up to these power hours, if you're not showing up to the open houses, they don't know who you are, guys. They're not going to send you leads. They're not going to help you build your book of business if they don't even know who you are. I mean, you got to show up. I hear a lot of agents are like, well, I don't get anything. It's like, well, do they even know who you are? You don't show up to anything. So, you got to show up. And I'm not saying you have to go to everything, but like, if you've got an Advent Health that's like less than 5 miles from your house, you probably should go check it out. So,
yeah.
Natalia, if you can put your contact info in there, or email, or whoever they should talk to about, maybe getting more information on Advent Health. I will say personally, I am a big fan of Advent Health. My kids were born, all of them at Advent Health, and they're phenomenal. Faith-based organization, but all in all, like, we've been waiting for them to get into the Medicare game seriously for a long time, and the fact that Natalia's there and knows what she's doing with her team. You don't want to miss this opportunity, because if I don't know how you guys wouldn't be the fastest growing medical group in Florida because of what you guys do. So that's what I'd say.
Yeah, definitely. There's a lot of great things coming, and the care, top quality care. Honestly, it's more than just, coming in and get your med refills. It's overall the whole body, mind, spiritual, and health wise. So we look forward to seeing you guys this week. My email and my phone number in the chat. And the closest one to South Orlando, Dr. Phillips or Windermere, will be our Winter Garden office.
Awesome. And then lastly, I'll say that Natalia has the best swag. She has the best swag. Just show up and you're going to get cool stuff.
Yeah, for sure. Definitely. Thank you.
Awesome. Natalia, thank you very much for being on the call. We really appreciate you.
Thank you, guys. Awesome. Have a great rest of the day and week. Thank you guys. Bye-bye.
Thank you. You got it.
Bye.
All right, guys, that's it for today, this week. We will be back next week, same time, same channel. I really appreciate everybody being on this call. If you bump into an HPM agent that's not on this call and they seem lost or confused, please make sure you let them know to be here 9 o'clock on Mondays, every Monday, so we can get the download upload for you guys. So with that, go out into the world and go save some lives. Thank you guys very much. Have a great week.